Hi, so I'm going to be demonstrating the use of the H-Sit7 and the Gracie 1-2 on the mandibular surfaces, facial surfaces. If I'm doing surfaces towards me, I'm going to be at 9 o'clock. And if I'm doing surfaces away, I want to be at 12 o'clock. And I want to make sure that the mandibular occlusal plane is parallel to the floor and that the maxillary occlusal plane is perpendicular. I'm using the mirror, the Seiko scaler, and the Gracie 1-2. So for the H-Sit7, this is a supragingival instrument and it cannot be used subgingivally. And it has 2 cutting edges per working end. So to choose my cutting edge, I place it in front of me and I look at the side that the working end bends. And so in this case, it looks like it's bending more towards the left side. So I'm going to choose the right cutting edge, which is going to be surfaces away. And so I'm going to use a modified pen grasp. And I am going to make sure that I use my mirror, which is going to help me to be able to see since it is surfaces away from me. So I want to make sure that I adapt the tip third of the instrument and that I am using exploratory strokes first to locate the calculus, also using exploratory strokes to evaluate my technique of removing the calculus. Exploratory strokes is going to be light pressure, and I'm making sure that I am using angulation that is 60 to 70 degrees, and that the lower shank is parallel to the long axis of the tooth. I want to make sure that when I do the working strokes that I'm using more pressure, lateral pressure, that I'm doing vertical, oblique, and circumferential strokes. So I'm going to establish my modified pen grasp, establish my fulcrum, and adapt the tip third. And this is my working stroke, making sure that I roll to adapt. And that I'm using my wrist for activation. And the mirror is helping because I'm at surfaces away. For the Seiko scaler, it's going to be 70 to 80 degrees supragingival for the angulation. And for surfaces towards, it's going to be look at the side of bends, use the opposite cutting edge. Minister, modified pen grasp, adapt tip third, use exploratory strokes first, and then my working strokes. Wrist activation, making sure that the shank is parallel. Okay. And then for the Gracie Curette, this has 1 cutting edge. I'm using the lower cutting edge for my strokes, and to do that I just place it in front of me, look at the lower cutting edge. I can also place it against the tooth surface and make sure that the face is towards the tooth surface. So in this case, this is going to be the right working end. This is a supra and subgingival instrument. Again, making sure that the mandibular occlusal plane is parallel to the floor. Modified pen grasp, adaptation closed angulation. Using exploratory strokes, which is light pressure, to locate calculus and evaluate my technique. And then my working strokes.
Yo, we spreading.
And using wrist activation. For the Gracie curette, it is going to be, the angulation is going to be 60 to 70 degrees. And for surfaces away, I'm going to use my mirror again. Modified pen grasp, establish my fulcrum. I'm adapting the toe third of the instrument, of the working end, to the tooth. I'm using exploratory strokes, wrist activation. This is a sub-gingival instrument. And I'm rolling to adapt. So that was my exploratory strokes and then my working strokes. Making sure I'm going subgingival. And I'm just making sure that I have a root surface that is biologically sound for root attachment. Thank you.